So Mike Amendola here again. So you want to publish a paper. This is part of medicalstudentmentoring.com. Please join us online. The plan again is who, what, where, when, why, and how. Who is you? The real question is who else? Whenever you're writing, is you have to figure out who is taking the lead on writing anything and publishing anything, who's potentially mentoring you. But part of that is figuring out who's done it in the past, who's doing it in the future. Where is the project along the way? How do you fit into it? And figure out who the good and bad characters are. You don't want to get into the business of being the ghostwriter for a chapter for an upper level resident, for example, or another attending, and not get any writing credit. Write about what you like. Be careful when asked to write about something. Find out exactly what your role needs to be. Remember, you want to figure out what people are writing about, and you want to be unique in what you're presenting, and you want to enlighten the rare. So these are a couple examples. I'm going to fly through some of the papers that we've published, touch on topics that are not often addressed. For example, hemodialysis access is a very common thing that most times will make it into writing once it's been researched. Common things from novel angles, looking at something as common as a common femoral artery access, looking at online resources and how those are portrayed, was one of our papers in the past that had a very good playtime in the national kind of scene. Again, a common thing that's done from a unique angle. Know the analysis, applying an analysis to a new patient population. So think about, and a part of this is reading the literature, thinking about how people are looking at things, and then applying them to your own patients. Utilizing national databases is now becoming more and more common. It's something that you can get involved with as a medical student, get into the database, but also publish about it. Keep your eyes open, especially when you're on call, for the interesting, and look for case reports. Always ask, how rare is this in terms of interacting with your attendings? And if it is rare, find out and ask very early on if you can be the lead person and involved with writing up a case report. And then again, involved with ideas that potentially are not on your plate. This is a paper that we looked at in terms of the well-being of residents and giving them a survey to assess that. And then be the first, no matter how simple. This was a paper that we wrote about looking at ultrasound identification of a wire in the midst of endovascular procedures. How easy, what could it be done? And then part of writing at any time, this is one of my first papers, is being at the right place at the right time in terms of an attending approaches you and says, hey, would you like to write up this series? This is one of the more frequently referenced articles on esophageal perforation and stenting. Remember that if you're writing case reports, this is what I call the ladder of publication, case reports being at the lowest left, randomized controlled trials at the upper right. It takes years sometimes to write up a randomized controlled trial, but something like a technical art or retrospective analysis can take weeks to months. So be aware of the timeline of what you're trying to write. Where you publish something is important. This is just some impact factors of some common journals to look at exactly where you would potentially look at your papers being referenced once they are in print. Where you do it is you're interacting with a journal once you have submitted it for publication into what we call the portal. The portal produces these kinds of things, which just tells you about your article and then says, hey, this is what the reviewers have to say about it, and gives you some feedback about how you alter your article. When do you do it? You do it in the gaps in your time. You do one part at a time in terms of work on the introduction, you work on the methods, you work on the results and the discussion. Is usually the hardest part of the article, but you're doing this on weekends, nights, holidays, and also my common thing is to do it on a plane ride. Why do you do it? Why do you publish? For CV building authority in terms of authentic voice within the specialty. It leads to other things and other opportunities, and it's fun to write about what you enjoy. So how do you start? You want to take an abstract, explore what's written, expand on what's on an abstract, discover your own writing style, and have fun. That leads to really, what is it? How do you write? I often draft many times. I enlist help later on in the process, but do ultimately what makes sense to you in terms of a discussion with your mentor. So how do you get from an abstract to a paper? Start with an idea, go to the data. The data supports that idea and analysis. This is an ongoing process in equilibrium that you're commonly revising these things within the abstract, and then from there you expand on the idea for the introduction. The data is what your results section is, the analysis is the methods, and then the conclusion is usually the discussion. And this again works up a ladder as well in terms of going from introduction to discussion, usually being the hardest aspect of any publication. How to deal with this? This is typically what I do is I'll mark up a lot of manuscripts that are sent to me. You want to just take it all in stride. Remember that whoever's giving you the feedback is trying to help you the best that they can. You will get these, which are outright rejections when you submit papers. Do not fear that. It's just part of the price of being in the realm of publication. So when that does happen, say, hey, I don't want this to happen. Nobody wants to be rejected, but why? You want to rethink, regroup your approach to things. Potentially, you want to redo and retool. But ultimately, you got to figure out, hey, do I have a dead project? Do I have a dead paper? You might want to rethink your approach, but you also might want to rethink who you're working with. If you have a mentor that is not responsive to you, you might want to table it and work with someone else, and potentially you might even want to think about moving on. So, in conclusion, this is a process. It does take time. You might fail, but hang in there. Stay focused on what you're trying to do, and be part of the process. Even participating in a publication that fails to get to a journal will help you grow and will be helpful in your the formative process of you being an academic surgeon. Please, this is scan code for medicalstudentmentoring.com. Please follow us online, and please scan and shoot me an email. I'll be happy to give you any feedback that I can. Thank you very much. These are my references. Have a good day.